Good morning, everyone. Bob Ravenscroft, the Vice President of Advancement at Bryan Health, here for our May 29th media briefing. John was unable to join us today, so I'll cover all of the stats, answer one advanced question, and then we're going to outline our new visitor or support person guidelines that will be going into effect on Monday, and then open it up for general questions. So real quickly, our overnight census or midnight census was 435. The tests now administered by Bryan are at 9,131. We have 1,257 positive results from them, and we have 327 pending. So what's going on inside the hospital right now? The number of positive COVID-19 patients that are hospitalized at Bryan registers at 23. 17 of those are Lancaster County residents and 6 from other parts of the state. Our total in-house positive and pending obviously remains at 23. It's that same count. And of those that are in-house, those that are on vents registers at 10 right now, and 6 of them from Lancaster County. The positives in the ICU are 12 patients. In our progressive care unit, 4, and in general care, it's 7. So again, that's the rundown of what's happening in Bryan Medical Center. The one advanced question we had submitted by Andrew, he was referencing a comment at UNMC about a record number of COVID-19 patients admitted on Tuesday, and their doctors described things as a slow tsunami. It builds and it becomes a massive wave. What are Bryan's numbers? Well, we just shared our overall hospitalized numbers, and we had one direct admit that was a previous positive that was tested, taking care of themselves at home, and was admitted yesterday. So as you guys have been following, there is a slow rise of patients. We remain in a good spot. I think what is probably creates the most anxiousness around here is there seems to be a fine line, not just here but everywhere across the country, from being okay to having your health system stressed. So that's why we continue to implore your help with masking, hand hygiene, social distancing, and certainly appreciate those that are helping us. Omaha, as you guys know, if you're following it, is firing a little bit differently than us right now, but we're keeping a close eye on things. So that was the advanced question and the stats. So what we're going to do today is reveal some new visitor support person guidelines. Out of all of the operational changes, modifying our facilities, standing up the testing, which was really one of the earliest and most robust in the region, the PPE challenges, all of the decisions around that paled in comparison to the decisions to restrict visitors. There were nurses and techs and physicians and chaplains, security personnel, members of our facility team that were taking the roles of families and volunteers during this time. There were really some heartbreaking situations. So, I know it's not probably as far as some people would like us to go, or as, maybe it's too far for others, but we're pleased to reveal some loosening of these standards. So let's start with those patients that are COVID-19 positive. There are no changes to this. Unfortunately, no support person will be allowed to visit with these patients while there's a COVID test pending or with a confirmed diagnosis. So no changes to that. But for those patients that are not COVID-19 positive, if they're here with an overnight stay for non-surgical needs, one of our general care patients, they are now going to be able to have one healthy adult support person with them. And we're calling it a support person because for some it might be, their clergy or their priest. It might be an adult child. It might be a friend or confidant. It might be a spouse or a partner. So support service or support person is pretty broadly defined, and it is defined by the patient themselves. And to start with, we will allow that support person for these general care patients to visit between 5 a.m. and noon each day. So then let's talk about the overnight patients that are undergoing a surgery that requires an overnight stay. They too will be able to stay with their loved one that they've been assigned to for 1 hour after the transfer to their room following surgery. And then for all subsequent days, they can also visit from 5 a.m. to noon. It kind of moves us to the next category, which would be those patients having same-day procedures at Bryan. If it's a same-day surgery, the one healthy adult support person can stay with that patient until they are discharged from the hospital with their same-day surgery. This also goes into effect for those that are visiting our facilities for a diagnostic test, interventional procedure, something in maybe the specialty clinic, one of our tenants, or a Bryan Heart, because the Bryan Heart practice, as you guys know, is located on the Bryan East Campus. That one healthy adult support person can accompany them to the visit if they need to, and they can stay with them throughout the duration of the appointment. And this is really going to help because we essentially had, you have the cell phone parking lots at airports. That's essentially what was going on here is those people accompanying the patient would have to wait outside the facility before they could come in. There are some existing guidelines that are going to continue as they have been. And you'll have the 24/7 ability for a healthy adult support person to accompany people to the emergency department in labor and delivery. They can have the one labor partner with them during delivery. For our NICU babies, they can have both of their parents or guardians with them. And no changes to what we've done with our pediatric or minor patients. And then sometimes there's dependent adults needing special assistance, and this can be, people that are dealing with memory care issues. It might be a translation issue. It covers a myriad of things, but they will still be able to accompany their loved one there. And then there are going to be some special circumstances for end of life. Again, gut-wrenching scenarios have played out over the past couple of months here. And this is kind of how it's been going. These are kind of a case-by-case situation where the nurse manager and the nurses of that patient gather together and make the most appropriate decision for a family. It's not to be confused with doors are open in those situations. It's very controlled, and they sequence when people can come in and so forth. So those are handled case by case. However, unfortunately for the COVID-19 patients that are at end of life, unfortunately those will remain very difficult situations for families to encounter. There are some requirements for people to do this. If you are the assigned support person by your patient, you're going to be required to wear a mask in here. You're going to be required to answer screening questions and answer temperature checks. So please be patient with us when we go through that process and bring folks in. But I think we've made it very clear our position on mask wearing and what it takes to be in our facility. And then even with that, there are tons of other ways to connect. Go to our website. This is where it's all spelled out in detail. But what you'll find there is there's a special friends and family portal that gives updates on the patient's status to keep families up to date. That's something that's been in place, long before this as well. To order gifts, you can do that online or by calling our gift shop. There's e-greeting cards that are also available, and then certainly the old-fashioned way of calling the patient room. Clearly, in this day and age, people are using their own personal devices. With your personal devices, if you have, if there's charging needs or extension cord needs and so forth like that, members of our volunteers and customer care staff will gladly run those up to the nurses to get to patients to make sure you can stay connected that way. And then through our volunteer and customer care office, also there's a way to send special acknowledgments through them. So again, all of that is available on our website. Went through that pretty fast. We hope the accompanying slides helped explain the different processes in place. And with that, I would open up any questions from the media on any of this. And as usual, we'll try to address them to the public via Facebook if you submit them there. So again, very pleased to be able to loosen this. We understand it's not going to be perfect for everyone yet, but it's a step in the right process or direction.